This is a five-fold increase from just a few short months ago, as we have steadily increased capacity at our Stop the Spread testing locations. And here at our newest express testing site at Suffolk Downs, in partnership with the Commonwealth, HYM Investment Group, Project Beacon, and Physician One, we will provide another accessible, convenient, no-cost option to our residents and to our neighbors, and allow us to reach even more people. More testing combined with contact tracing and isolation of positive cases is our city's best defense against the spread of COVID-19. And until we have a widely available vaccine, this strategy is the only way to keep our economy running. Now, I talk every day with local business owners in the city of Revere, restaurant and cafe owners, gym owners, hairstylists, barbers, daycare providers, and they are all struggling. They're struggling, and they're also relying on us. They're relying on us not just by patronizing their businesses, but they're relying on us to be part of the solution and not part of the problem when it comes to slowing the spread of this virus. And when it comes to COVID-19, despite what we've heard, especially down in Washington, D.C., ignorance is not bliss. If you have been knowingly exposed to the virus, and if you continue to expose yourself to others, not only are you putting our seniors and our most vulnerable at risk, you are putting another obstacle in the way of our business owners and our economy. And I say that as I think about where we are in the city of Revere. Long after this test site is gone, Suffolk Downs will be the site of jobs, housing, future economic opportunities, and future economic advancement for many, not only in the city of Revere, but also in the region. But we all have to do our part now to keep our city moving forward. So if you don't feel well, get tested, isolate at home. If you're contacted by the local Board of Health, answer the call. Follow instructions for quarantine and testing. And be truthful in the response that you give to their questions. This is critically important, and this is a major challenge that we're seeing here in the city of Revere. And finally, I feel like I've said this a million times now, wear a mask anytime you are around others, especially at home with vulnerable family members. It can't be said enough. Each and every one of us has the opportunity and the power to save a life. And we can save that life with our own actions. And most importantly, it may be the life of a loved one that we save. I want to thank you all for being here. I want to thank everyone for their support for the city of Revere. I am going to now turn it over to the governor, Governor Baker, and it is with my deepest gratitude for your leadership. I wish we saw more of it down in D.C., but your leadership and your dedication to the residents of Revere and to the residents of the Commonwealth. Governor, thank you.
Thanks very much, Mr. Mayor, and I want to just say how much we appreciate your partnership as we deal with the fall and with COVID going forward. And I also want to thank everybody for coming out. I said to the Lieutenant Governor when I got out of the car that my most intense memory of this particular site is as a snow farm in the winter of 2015, and I think the snow was here until July 4th, I mean, that's my recollection, is that sometime around the 4th of July, the final snow from the storms of the winter of 15 finally melted away, and I got a good look at everything that was inside that snow farm, and it helped me understand why it was nobody likes people to dump snow directly into the ocean, because, well, let's just suffice it to say there was a lot of stuff there that probably didn't belong anywhere other than in a licensed refuse and material disposal site. But I digress. We're here today to talk a little bit about this new testing resource, as well as to share some details concerning vaccine distribution planning. The daily update: yesterday, the Department of Public Health reported 827 new positive cases. The 7-day average positivity rate is 1.2%, which is consistent with the last few weeks of reporting. But we've obviously seen an increase, which we expected and anticipated, in overall cases over the past couple of weeks. Our hospital census remains roughly right around 500 patients, including 86 in the ICU. While there's been an increase in cases, our hospitals have the capacity to manage COVID-19 patients and others needing medical attention. And the Lieutenant Governor, the Secretary, and I continue to talk with the vast majority of the hospitals and the systems here in Massachusetts several times a week. Some of that occupancy rate also reflects patients who are not yet confirmed to have COVID but are awaiting test results. We continue to talk to the hospitals about trying to refine that number, particularly as we head into the fall. 17,654 new individuals were tested, which brings the total number of individuals who've been tested in Massachusetts to over 2.5 million. That's about 1 in 3 residents of the Commonwealth have been tested at least once. And over 5.2 million molecular tests have actually been administered overall. The Command Center has worked enormously hard with many partners, such as the ones we're here with today, to scale up the Commonwealth's testing program over the course of the past few months. At the beginning of the pandemic, back at the end of March, we were conducting about 2,000 tests a day. By May, we'd scaled that up to around 13,000 tests a day, and we're now at a point where we're regularly testing north of 60,000 individuals a day. And earlier this month, we set a record of 91,300 tests conducted in a single day, and we'll soon have the capacity to administer more than 100,000 tests per day. We've also scaled up lab capacity here in the Commonwealth, with about 100 labs now conducting testing in the Commonwealth, which is up from about a dozen in the earliest days of the pandemic. And our average turnaround time for testing is now less than 2 days. There are over 250 testing sites across the Commonwealth, and Stop the Spread sites like this one are operating in 18 communities and are serving in many respects as regional centers for people who want to get tested. Happy to be opening this new site here in Revere. Here is Revere with the mayor. And I just want to say thanks to Secretary Sutters and her folks. These Stop the Spread sites have proven to be a valuable tool in our fight against the virus. We'll continue to operate the sites until at least the end of the calendar year, but they are in many respects a terrific asset to help us help people get tested, determine if they have the virus, and if they do, we can then use contact tracing and support services to help them isolate and to help them deal with other issues like keeping their family safe during that period of time. This test site was opened last Thursday in partnership with Project Beacon. Could the Project Beacon people just raise your hands so we all know who you are? Thank you very much for your willingness to help us with this. And as I said before, the tests are free to all Massachusetts residents. The site's open 7 days a week. At full capacity, the site will be able to conduct 1,000 tests a day. All are performed through this drive-thru format with people in their cars, which is safe and efficient for staff and for the public. It's by appointment only, and people can look to get tested here. And if you're interested in getting tested here, you should visit beacontesting.com to register to get tested. Again, Mayor Arrigo, I want to thank you and your team for working with the Command Center to secure this site. Since it's right next to Route 1A, it's a convenient spot for people around the region to come get tested. And our message around testing remains the same. It's one of the most powerful tools we have to keep you, your family, your friends, your neighbors, your colleagues safe. If you feel sick, you should get tested. If you've had close contact with someone who was recently diagnosed with COVID, you should get tested. If you attended a large gathering, or even if you attended a small gathering, or you just returned from out-of-state travel, and you were with a lot of people who weren't wearing masks or socially distancing, who are not your immediate family, you should get tested. If you're planning to go visit older, senior members of your family who you haven't seen for a while, and you've been out and about with younger folks in close contact and you haven't been wearing a mask, get tested. It's widely available across the Commonwealth, and people need to take advantage of that. I also want to give a quick update on the work we're doing with high-risk communities like Revere. The Command Center's COVID-19 Enforcement and Intervention Team has been working closely with local officials and communities that continue to see high rates of COVID. We've ramped up public messaging in these communities, including through a multilingual public messaging campaign. And last night we added a new step where we activated a wireless emergency alert to phones in several high-risk communities, including Chelsea, Everett, Lawrence, Lynn, Nantucket, New Bedford, Revere, Framingham, Winthrop, and Worcester. Local officials have all told us that this was a great success, and they felt it was a very effective way to reach their residents with an important and pertinent message. You might recognize the alert system. It's the one we use more typically to alert people to serious risks in their communities, usually weather emergencies or Amber Alerts. COVID is a persistently high risk in these communities, and this alert is another important message to remind residents to be vigilant. It's also far-reaching and goes to every cell phone in the area to make sure people are informed, even if they haven't seen something on TV or somewhere else in the news. The text alert contains a website link where folks can click to learn more about what they can do to stop the spread of COVID-19 in their community and be safe. Obviously, the short message is wear face coverings, get tested, stay home if you feel sick, stop having gatherings, especially big informal ones where people spend too much time close to each other, share food, share drink, don't wear masks, and don't practice social distancing. Those are exactly the sorts of things that create that big increase in positive test results for people between the ages of 19 and 39, which is where the vast majority of the increase in positive tests has been happening, not just here in the Commonwealth, but in many places and states around the country. This alert is part of a broader campaign we have to remind residents that COVID remains a serious risk and folks need to continue to take precautions to protect themselves, their loved ones, and their neighbors. We also encourage residents to sign up to receive alerts that are specific to their communities as part of the new Alerts MA system by visiting mass.gov/stopcovid19. Residents can choose to get alerts by text, email, or phone, and in their preferred language. Secretary Sutters will speak in more detail in a minute about other work that the CEIT is doing. With respect to vaccines, we've all talked a lot about the fact that, and the mayor just said it, the COVID's going to be with us until there's a vaccine or treatments. Until then, we have to respect it, learn to live with it, and factor that into every aspect of our lives. Well, several world-renowned companies, including some right here in Massachusetts, are working around the clock to discover a vaccine. State government is developing a plan to distribute the vaccine safely and equitably based on federal guidelines. On Friday, our administration submitted its interim draft COVID-19 vaccination plan to the CDC, which is a requirement for all states. The plan was developed by an interagency vaccine working group that was led by the Department of Public Health and advised by our COVID-19 vaccine advisory group. We've relied on some of the brightest minds in the public health space to put this together, and our medical advisory group includes medical professionals, public health experts, elected officials, community leaders, and infectious disease specialists. The plan lays out initial steps in our state's planning for a robust, comprehensive, an equitable vaccine distribution system once one or more vaccines are available here in the Commonwealth. We're planning for different phases of distribution based on how many vaccines are available and when. In the early phase, we expect limited supply, and we plan to prioritize the following groups: healthcare personnel who are likely to be exposed or to treat people with COVID-19, people at increased risk of severe illness from COVID-19, including individuals with underlying medical conditions and those over the age of 65, and then other essential workers. The plan also outlines our messaging efforts to make sure people know, once there is a vaccine available, that it has been approved by the federal government and is safe and effective. We'll also make it a priority to reach out specifically to groups that have been disproportionately impacted by COVID-19, including people and communities of color. While this is an interim plan that will probably change as more information becomes available, it's an important step forward as we continue to work toward the day when that vaccine is available for use. And while we continue to plan for a distribution of a vaccine, we can't take our eyes off the measures that we've been talking about for the last several months to keep people safe. As many epidemiologists and public health experts predicted, we have seen an uptick in positive cases in Massachusetts, across the country, and in many parts of the world. While we continue to closely monitor new cases, including testing and tracing where the infections are most prevalent, our Commonwealth is in a strong position to keep fighting this virus. Since last spring, we've made significant progress to build a massive infrastructure for large-scale testing and tracing. We've stockpiled enough PPE for frontline healthcare workers to last us through 2021. We've created and sustained a gradual reopening of our economy. People are back to work, and businesses and schools are in business. We all understand just how incredibly contagious this virus is and what we all have to do to stop the spread. And as I said, the virus is here to stay until there's a vaccine or a treatment. Our best defense is every single person doing their job and taking the responsibility to protect themselves and each other. That means, once again, wearing a face covering, practicing social distance, not hosting or attending large gatherings, especially those indoors as the weather gets colder, washing hands and practicing good hygiene, staying home if you don't feel well, and getting tested for any of the reasons I suggested before, and many more. The testing capacity is there. People need to use it. And we'll continue to bring every resource to bear that we can during the pandemic, but we really need each and every resident of the Commonwealth to stay tough, stay vigilant, and work with us to keep fighting and containing the virus. With that, I'll turn it over to Secretary Sutters.
Governor, Lieutenant Governor, Mr. Mayor, thank you for having us here today. Good afternoon. There are many elements to respond to COVID as we enter the fall and winter months, as well as to help stop the spread. Testing, as you can see here, is one critical component, and our testing capacity is strong. We continue to be a top testing state on a per capita basis. As I mentioned last week, and as the governor said, our Stop the Spread initiative will be extended through at least December because it's a valuable resource for our residents and our municipalities impacted the hardest by COVID. We'll be living with COVID for many months. This level of testing with timely turnaround, less than 2 days on average, is one piece, but not the only piece of a strong foundation to identify individuals who've tested positive, their close contacts, to stop the spread and inform policy and practice. As you heard, the testing site here in Revere is an example of tremendous collaboration, starting first and foremost with the City of Revere, with Project Beacon, the gentlemen sort of raised their hands, the Broad Institute, and Physician One Urgent Care, and some staff from the command center. Project Beacon developed the technology to ensure that the testing experience is user-friendly and convenient. You register online, you book an appointment, and receive your results all on one platform. The Broad Institute, since the very beginning of the pandemic, has been a strong partner, ensuring residents of the Commonwealth have local access to PCR testing with a quick turnaround. As you heard, once operating at full capacity, this site will have the ability to test 1,000 people a day, and there will be no wait because they will have confirmed appointments. We are using federal funding from the Paycheck Protection Program and Healthcare Enhancement Act to support this site. Our COVID enforcement and intervention team continues to collaborate with the most persistently high-risk communities across the Commonwealth. Every week, the mayor and his key staff and mine get together to talk about numbers, trends, issues, areas of further collaboration. From Springfield to Revere, our teams are working together to stop the spread. The work includes enhanced enforcement activity and increased public messaging to help raise awareness. Recently, the collaboration discovered and disrupted a planned large party scheduled for October 10th in Revere. Previously, other impromptu parties in isolated areas very early in the morning, including vacant lots, have been held with hundreds of young people, not wearing masks and not social distancing in the late hours. Very much the type of super spreading event that is not only prohibited, but potentially dangerous. A similar event in Everett had occurred in September, attracted more than 300 people. Again, no masks, no distancing. Typically, these are held on private property, away from all of our eyes, without the owner's permission. The party plan for Revere was promoted through social media and was brought to our attention through the Revere City municipal leaders. Working closely with them, the Massachusetts State Police identified the potential organizers and stopped the illegal party before it took place, and has interrupted future parties by this organizer. That's just one example of working together so closely between the state and local municipalities. While this is a high-profile and very impactful example, our ABCC and DPL teams have inspected now more than 5,000 businesses. These are critical to ensure compliance with masking up, social distancing, and monitoring gathering sizes. Like so many other high-risk communities, Revere has been a strong collaborator and partner. In addition to these enforcement activities, we have significantly increased our public messaging in multiple languages. Working with MEMA, we sent the wireless emergency alert the governor mentioned last night, sort of a jolt, if you would, to our communities. In Revere, just last weekend, our field teams, along with the municipality, distributed 850 masks and approximately 1,500 flyers in Spanish and Portuguese. An example of this collaboration, Revere has hired community ambassadors to work hand in hand with us, growing the size and impact of the teams. Combined in our highest risk communities, our field program, our Boots on the Ground, has handed out more than 175,000 flyers in multiple languages, 82,000 masks, 16,000 bottles of hand sanitizer, nearly 200 large sanitizer stands at businesses, and talked to hundreds of thousands of residents about taking precautions to stop the spread. We're engaging with Worcester State University's COVID-19 education program, which was organized by the Latino Education Institute and in partnership with the UMass Memorial Medical Center's COVID Equity Group. The teams have been very active in Worcester since July and have proven to be an excellent resource for residents and students. This collaboration extends to dozens of faith-based organizations, such as the Worcester Interfaith Council, multicultural groups such as the Southeast Asian Coalition of Central Massachusetts, and business owners in all of our communities. Worcester health officials believe that the uptick in testing in certain neighborhoods is directly related to our on-the-ground CEIT field teams. In Springfield, where we've just started our outreach, we're meeting with the neighborhood councils to discuss how best to enhance public messaging and get people tested. But today in Revere, I want to thank Mayor Rigo and his team for the extraordinary partnership in developing this testing site that is valuable not only to residents of Revere, but residents of surrounding communities and to the Commonwealth. And to all of us, we need to stay strong and stay vigilant. Governor?
Questions for us or for the mayor?
I have a question about things like your warrants as well. So
Yep.
high copy numbers. The asymptomatics
once again, the primary driver behind most of the material and the information that we've seen associated with the growth in positive rates here in the Commonwealth is driven by informal events and social gatherings. And those are the places and spaces where if people are asymptomatic, they will give it to somebody else if neither of them are wearing a mask and they're engaged in close contact over an extended period of time. That's exactly what happens when people get together to have a house party or a backyard party or some other celebration, or just the kinds of stuff that we used to do once upon a time as a matter of course almost every weekend. The places and spaces where people are wearing masks, socially distancing, and following the rules and the guidelines are not where the vast majority of our problems are. And that's part of the reason why we sent that message out in some of our high-risk communities, to literally create, as the Secretary said, a jolt, to point out to people, everyone who's got a phone or who's traveling through those communities who has a phone, that this is a high-risk area and there are certain things that people should do and certain things they shouldn't do. And it's also a big part of the reason why the big increase in our positive test rates has come from people between the ages of 19 and 39.
So you don't anticipate rolling back at all?
I think what we have to do is continue to be as vigilant as we can be and to try to take some of the discipline and the vigilance that we've seen in formal settings and bring it to informal settings, especially as people move inside, because that's going to be our biggest challenge. And I said this before, find ways to reach younger people. And that whole idea behind that outreach associated with the emergency alert system doesn't care how old you are. All it cares about is where you are and whether or not you have a phone. There are a lot of people who got that message last night for whom it was probably the first time they heard from anybody directly about the issues associated with COVID.
Does it drive you kind of nuts that the state police have to get involved breaking up parties?
A lot of the activity, almost all the activity that's been involved in large gatherings, and the only time you really end up talking about local law enforcement or the state police are really big events. And generally speaking, that's typically done on a collaborative basis with the local law enforcement community, and it's usually what I would describe as a slow roll, which I think in this day and age is the only approach that makes any sense on this stuff. It takes longer than it should or than it might have otherwise, but I think it's an act of, I think that's the appropriate act and the appropriate way to handle those things.
Are there any penalties though? I mentioned this big party in Revere, there was an organizer, they managed to intercede and stop the organizer. What happened to that organizer?
You want to speak to that?
So I know there was an arrest made in connection with that event, and as the Secretary mentioned, there were other events that may have been planned and other promoters that we've been able to kind of get a handle on. But there was, in that particular event, there was an arrest made by the state police related to that promoter.
And these organized events, something some of these are ones trying to make money off of this, say somehow an anti-mask party?
What we saw was that it was just not necessarily an anti-masking party, but just a large gathering. Through our vigilance and looking at social media, we alerted in our regular conversations with the state, we alerted them to an event that was potentially going to happen in the city of Revere, and through really the folks that work on connecting with the community, we have a really strong community response team, and they're constantly looking at social media, constantly looking at different things that are going on in the city to get a feel for what needs are out there. So in that collaboration, we worked with the state.
Governor, there's a report.
Just a quick follow-up. If the ABCC, for example, or the DPL, or some of the other folks who are out investing a lot of time and effort in determining if people are complying in the more formal way with the rules associated with this, there are absolutely fines and in some cases, shutdowns of the business for a certain period of time, which is way more expensive in many cases than a fine. But we certainly are in a situation where the locals can pursue financial penalties, or the state or the locals can make arrests in these situations. Yeah.
There's a report that you are on Joe Biden's short list if we were to look at Republicans to join his cabinet, would you consider joining a Biden administration if that should happen?
Well, first of all, both the lieutenant governor and I said when we ran for re-election 2 years ago, seems like 100 years ago, that we were going to serve our terms, and I intend to do that. And you're going to be stuck with me for at least the next 2 years anyway. It's flattered to be considered, but I like the job I have.
Concerning the vaccine, you've got Governor Cuomo and the Governor of California both saying that set up channels and not put up federal government thinking about doing that here?
Well, we certainly have plenty of people here who will be part of the conversation with respect to any decision we make about what we choose to do with the vaccine. But what I've said before is at the end of the day, there are a lot of levers in place to determine whether or not this thing is safe and effective at the federal level, and frankly at the corporate level as well. And we would never go forward with this unless we had a high degree of confidence here in Massachusetts that it was safe and effective. And that's going to be a function both of federal data, but also the review that our folks here in Massachusetts on the advisory committee would put to it as well. Yeah.
Maybe. Hi.
Questions about some of the dashboard data that we analyze each day. Can you help break down how we get to the 7-day weighted average versus the daily positive rate? It seems like the daily positive rate is getting more attention recently because it's been higher. Are those the same numbers that go to the weighted average?
Do you want to take it?
It's a great question.
You know what? I'm going to turn it over to our data in chief.
It's funny you should ask that, because that is absolutely a conversation we've been having amongst ourselves. And I think you can anticipate that sometime in the next couple of weeks, we're going to try to update the way we collect and present a lot of this information, because when we originally started publishing the daily report on new tests, we didn't have a heck of a lot of people who'd been tested. And so for all intents and purposes, every test was a new test and a first-time test. We now have a situation where there are a number of people who've been tested multiple times. Now, some of that multiple time testing was all around one particular case of COVID. But then you have a lot of other people who've been tested multiple times that has nothing to do with one particular incident. You know, they traveled 4 times out of state and chose to get tested when they got back. They were involved in close contacts over the course of 2 or 3 months with somebody who got sick. A family member tested positive, and that was a family member that they saw, so they got tested. That's why you have a situation where we've done 5.2 million molecular tests, but only 2.5 million people have been tested. And we think that, so the daily thing creates confusion for people with respect to what's actually underneath it. The other thing that creates an issue for people is the fact that if you just track the number that shows up every day, and then you try and run it back over time against the baseline that's created later on in that report, the number that shows up every day represents a particular moment in time test processed. But the day the test was actually administered is where it lands in the report. So we have some work to do now that we're dealing with really large numbers, and the possibility that somebody literally could have been tested for all the right reasons 4, 5, 6, 7, 8 times since last March. We need to do some work to update this stuff, put it together in a package that's clearly defined and represents what I would describe as the way you'd want to build a dashboard once you have 5 million tests and 2.5 million people tested, as opposed to where we were when we put that thing together, which was a few thousand tests and a few thousand positives. Because I agree, at this point, it's confusing to me.
What's the best number people should pay attention to now that it's slowed that down? The weighted average, 7-day weighted average?
I think the 7-day weighted average is probably, I can tell you this, those are the numbers I pay attention to when I talk to these folks.
Last question. Governor, Mike Pence is going to be making a trip here this week. Do you have any plans to meet with him or talk with him about efforts to stop?
Is this in Massachusetts?
No, New Hampshire. Very quick.
I'm on a weekly call every week with the vice president and the members of the task force and governors generally, where they present on what they're up to, and we ask questions. We have a lot of access to them. I was not aware he was going to be in New Hampshire. Maybe I'll reach out to my friend Chris Sununu, who, when he's not busy suing me, may be interested in having a conversation about some things that he could raise on our behalf with the Vice President. The big thing I would raise with the Vice President would be the same thing I would raise with other members of the administration and people in Congress generally, which is there are a whole bunch of things associated with COVID relief that you have all agreed on, okay? The Senate's agreed on it, the administration's agreed on it, the House has agreed on it, the Democrats have agreed on it, the Republicans have agreed on it. And it's stuff that would really make a big difference with respect to people's ability to fight the virus and to stay safe across the country, and it would provide some predictability to state governments, to healthcare providers, and to local communities at a point in time when people are looking for that. And I would love to see them actually just finish the job on that. Thanks. So first of all, the board of directors does not have the same people on it now that it had on it when it chose Bennett Walsh. That's point number one. No, it's a totally different board. Yes. Second is it's not a totally different board. I think 4 of the seats have turned over. More than half the seats have turned over since Bennett Walsh was hired. No. No, it doesn't have. It has the same chair as it did last week and the week before, but it doesn't have the same chair it had when Bennett Walsh was hired. And we're currently in the process of filling the 2 open seats.
What's your criteria for filling those seats? If people who put their families there know that someone who's in charge
Well, we've filled 1 open seat so far, and that was with Sean Collins, who is a National Guardsman as well as a doctor and an EMS specialist. Is he a nurse? He's a nurse and an EMS guy. So they're going to be medical people.